to hear a replay. Yes, I'm talking now. Can Susan hear me?
I can barely hear her.
Can you hear me?
I can.
Okay. Okay, I'll talk louder.
You need the channel Diane.
Say testing.
Testing, testing.
Okay, that works now?
It does.
Okay.
Rebecca, this is Al. I see that Kristen and Dr. Coletta aren't here. Are they in a waiting room or somewhere where you have to bring them in?
Dennis, did you get a haircut? Dennis Mills, did you get a haircut?
Hotel.
Looks like it. You want to tell us what back door you went through?
Well, I'm not poofy, if that's what you're wondering.
Wait. You didn't shave, though. You didn't
No,
get a shave when you got that haircut.
That's what happened. The hair shifted down to here.
I'm hoping that was a home job and not some real back door.
It ain't too much of a whack job from there, is it?
Whoever it is, they missed a spot on your right side.
Oh.
Maybe it was the bow method.
Talk to my razor.
Now Alvin's showing off his haircut.
Okay, we are ready over here. I'd just like to check that everyone is here. Could I have all the board members just acknowledge that you're here? I see Ben and Dennis. And Marita.
Supervisor
and Gary,
Toffnell,
and Sarah. And Jack. Did I miss anyone? Okay, Susan, do you want to check and make sure all the city council is here?
Okay. I saw Joe here, Alvin's here, Linda's here, Amanda's here, and Veronica's here. I think we have everybody.
So we can hear. Your volume sure needs to be turned on. Perfect. Marita, are you here? and are
Yes, I'm here.
So have you got the encoder on? It's recording. We're now beginning the recording. So you can start whenever you're ready.
Marita, you're muted and I can't hear you.
Got it.
That's better.
I'd like to call the meeting to order. This is a joint meeting between the City of Angels City Council and the Calaveras Board of Supervisors. Welcome, City of Angels. And please, we are going to be as normal as we can, and we're going to do the Pledge of Allegiance. If you can stand, please do. Robin, can you show us a flag?
Yes, we're going to bring
Thank
it up in just a minute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. Thank you. We're going to move to public comments. This is for items that are not on the agenda, and we only have one item on the agenda, which is a public health update. So if anyone from the public has a comment, question, or please call in now.
We have one caller on the line. Caller with the number 011. You are now talking with the board. You can go ahead and begin your comment. Caller with the number ending in 011. You're live with the board. Can you hear me? It doesn't appear they can hear me, Chair.
Let's wait another moment before we proceed.
We have another caller coming in, Madam Chair. The caller ending with the number 415. You're live with the board. Go ahead and begin your comment now. We have another caller, Madam Chair. The caller ending with number 415. You're live with the board. Go ahead and begin your comment now. We have another caller. You're live with the board. Go ahead and begin your comment now.
What number was that?
The caller with the number ending in 415.
Okay.
Or 011 if you're 011.
What number was that?
The caller with the number ending in 415. Madam Chair, it doesn't look like there's any other callers at this time.
Okay. I really feel bad. This is that we can't technically do a better job of letting the public speak, but that's a challenge for tech services, I suppose. Okay, I'd like to move to the regular agenda. It's going to be a joint discussion with the City of Angels. Ms. Glanville, did you want to read it? Do you want me to?
I can read it.
Thank you.
Item number 1, Public Health Services, receive an update presentation from staff on COVID-19 novel coronavirus. And
Thank
we have
you.
18 public comments for this one.
And I know we have several letters to read, but we can do that at the end. Thank you. Oh, Dr. K. Dr. Coletta and Kristen, Mrs. Stranger, are you with us?
Here, Dr. Kaleda is going to begin.
Yes, I'm here.
Okay, thank you, Dr. Coletta.
All right. Good afternoon, Madam Chair, Board of Supervisors, and public. I'd like to begin with a Calaveras COVID-19 update for today, May 7th, 2020, and then get to some of the information about moving into stage 2 for the reopening of some of the business opportunities in the community. So COVID-19 by the numbers as of today, Thursday, May 7th, California's had about 60,000 confirmed cases and 2,500 deaths. Calaveras County remains steady at 13 confirmed cases and no deaths. No new cases were reported in the last week, almost 2 weeks. All 13 cases are classified as recovered with no COVID-19 related hospitalizations. This is really important as the first step in being able to relax the current stay-at-home orders in effect require that coronavirus case numbers be stable and that the disease be controlled and control be maintained. The residents of Calaveras have really answered the call to stay home, and thanks to them, we're in a position to begin moving into the next phase and stage of modifying the local and statewide stay-at-home orders. So let's discuss the status of testing, which is another critical ingredient in being able to move forward. 2 types of coronavirus tests are available right now. COVID-19 tests that look for PCR in the nasal swab are tests that determine whether or not a person has the infection right now, and antibody tests. Antibody tests test the blood for antibodies that are produced in response to previous infection and can help determine those who are immune, those who might be protected for moving into the economy and reducing their risk of serious illness if they were to get exposed. Approximately 450 COVID-19 PCR tests have been performed on Calaveras County residents to date with the 13 positive cases that I discussed. The goal for satisfactory testing capability will be the ability to test 1.5 per 1,000 residents of the county daily. This translates into the need to test approximately 70 individuals a day. I'll talk about that a little bit more later. Mark Twain Medical Center, the emergency department, the hospital, their community clinics, as well as the Valley Springs Health and Wellness Center and the MACT clinic system offer access to COVID-19 testing locally for their patients primarily who meet the current testing criteria. So it's to assist in the testing goal that we need to achieve. The state has set up 80 additional dedicated testing sites to help rural areas like ours meet this need. The closest test site is at in San Joaquin County, which launched last Monday at the Lodi Public Library. This new test site is through a partnership with a health services company called OptumServe. Testing will be by appointment for those who meet the screening guidelines, and the testing will be conducted 7 a.m. to 7 p.m. Monday through Friday, and appointments can be made ahead of time by going to their website, and we posted the information on the website in a press release yesterday, and will again on our website, as well as calling an 800 number. Walk-ins won't be accepted, so people have to either log into the website or call the 800 number, give some basic information, register, and can get tested at the Lodi site pretty readily. Because of the high mortality rates associated with congregate living facilities, an effort's underway to test all of the residents and staff at Avalon Skilled Nursing Facility in San Andreas. That's Calaveras County's only nursing home. This will identify any potentially asymptomatic residents or staff in the facility, and then we can initiate isolation and quarantine efforts to prevent transmission. Most of the public has heard about incidents of outbreaks in nursing homes and the high mortality rate that's associated with that. So nursing homes are really a primary focus so that we can put efforts into place, increase testing capability, and protect those most vulnerable residents of our community. Okay, so now I'll address the current situation regarding the state and local stay-at-home directives. Monday, Governor Newsom announced that beginning tomorrow, this Friday, May 8th, the state of California will begin putting into place a process to allow for a gradual move into stage 2 of California's pandemic roadmap. This is a 4-phase roadmap to removing the current stay-at-home restrictions and reopening the economy. So it begins with stage 1 that we're in now. That's pretty much the lockdown of which we've all been experiencing. Now, stage 2 is starting to allow for low-risk retail businesses and their associated manufacturing and logistical support services to start up. Stage 3 is higher risk businesses such as fitness clubs, spas, nail salons, hair salons, barber shops, tattoo parlors, that kind of stuff, which require more personal contact to be able to reopen. And then finally, stage 4 is mass crowd events like conventions, concerts, sporting events. Those won't come until a later date, and it won't be soon, even under the state plan. So I wouldn't expect them until there's a vaccine or wider spread immunity in the population, because getting 15, 20, 30,000 people together in a very close setting is a recipe for getting back into widespread transmission. So now moving into stage 2 of this roadmap includes creating opportunities for lower risk sectors of society to adapt and gradually reopen through a statewide modification of the stay-at-home order. Though the details from the state administration are still being finalized, we do know preliminarily what the first steps for moving into stage 2 entail. Low-risk businesses such as clothing stores, shoe stores, florists, bookstores, sporting goods stores will be allowed to reopen for curbside pickup only. These businesses will need to operate under pretty specific adaptations to allow for increased social distancing, safeguards for their employees, increased sanitation. It won't include restaurants for in-establishment dining at the beginning of stage 2, or it will not lift the overarching requirement that all Californians must stay at home. The governor also announced on Monday that while the state will be moving into stage 2 together, counties that can show the readiness can move more quickly through stage 2, and they'll have to attest that they meet certain readiness criteria. So I'll discuss what those are. So counties have to create and submit a readiness plan to the state, and that has to be made public. And Calaveras, I feel, is well positioned to move more quickly through the stage 2 process to be able to get out in front of the state because of the ways that we are positioned to be able to meet those readiness parameters. So therefore, counties may attest to local variance based on meeting specific readiness criteria, and they'll have the ability to move further through stage 2 of the roadmap if this local situation allows. The readiness will be evaluated through a county self-assessment process, taking into consideration the following readiness parameters. Number 1, epidemiologic stability of COVID-19 prevalence in the community. That's defined as less than 1 case per 10,000 population in the past 14 days and no deaths. Number 2 is protection of stage 1 essential workforce. So we must show to the state that we have the necessary supplies and resources to ensure the safety of the critical infrastructure workers. 3 is testing capacity. So as I mentioned a little bit earlier, we need to show the ability to test 1.5 per 1,000 residents daily. That needs to be our test volume in Calaveras County. So that translates into, if you do the math, about 70 persons per day we have the capacity to test. And we feel that with the combination of the new OptumServe testing site in Lodi that's available to Calaveras residents, as well as our local capabilities for testing, will be able to meet that readiness parameter as well. Containment capacity. That's defined in terms of sufficient contact tracing capability on the part of the public health department. Those are those contact tracers that you've heard of, the people who will need to interview, get information from, understand who people who might be future cases have had contact with, and who those people are so that we can track this, isolate those individuals, get them tested, and prevent transmission from occurring in the community as we go forward. Hospital capacity. There has to be the ability of our local hospital to surge bed availability by 35%. And Mark Twain Medical Center has the ability to do that. They have written plans for that. And they have to have a detailed plan in place to protect the hospital workforce and patients. And then finally, we have to show the ability to address vulnerable populations. An example is an availability of greater than 14 days of personal protective equipment for the local nursing home. That's the masks, the gloves, the gowns, the face shields, all of the things that materials that protect healthcare workers and can protect those most vulnerable people in our community, like I talked about, those who live in a congregate living situation like skilled nursing facilities and even some assisted living facilities. So once we have access to our local status in meeting the state readiness criteria, we'll be able to attest to the local variance process and be allowed to move forward further into stage 2 than the state. Calaveras public health staff have been evaluating and compiling local data as it relates to the governor's 6 critical indicators for reopening the economy framework over the past several weeks in preparation for the ability to potentially move gradually deeper into stage 2. Even though we've just received today the criteria for evaluating Calaveras County's readiness, we feel that we're positioned well and we'll be able to engage in this process for responding to the state. When we have the ability to assess our local readiness through the application of this information, we will expeditiously evaluate our local readiness parameters and continue to communicate with the public regarding which local retail businesses and supporting manufacturing and logistical entities are eligible to reopen. Kristen can provide a little bit more detailed information on the specifics surrounding what businesses will be allowed by the state to begin operation beginning on Friday, which business types will be allowed once our variance process is completed to begin operations, and what restrictions and parameters they'll have placed on them.
Good afternoon, members of the board and members of the City Council, Kristen Stranger, Health and Human Services Agency. So to continue on with what Dr. Kaleda was just speaking about moments ago, I'm going to first start with a little bit of information about what specific industries are allowed to reopen with those specific modifications that were detailed by the governor earlier today and earlier throughout the week. So for the first round of businesses that are specifically allowed to open under the governor's modification, they include curbside retail, including but not limited to bookstores, jewelry stores, toy stores, clothing stores, shoe stores, home and furnishing stores, sporting goods stores, antique stores, music stores, and florists. Please note this will be in a phased-in process, and these businesses are allowed to begin operating tomorrow with those specific modifications in their business practices that were detailed earlier and will be made available on the state's and local websites. They can start operation in this modified manner beginning tomorrow with curbside pickup and delivery only until further notice. In addition, supply chains supporting the above businesses in manufacturing and logistical sectors will also be able to operate in those modified manners. So that is what's going to occur beginning tomorrow, absent of any input from the local health department. Relating back to the readiness factors in that data collection necessary to move Calaveras County further in to further phases of stage 2. Later stages of stage 2 businesses that will have the ability to open with specific modifications include destination retail, including shopping malls and swap meets, Personal services limited to car washes, pet grooming, tanning facilities, and landscape gardening. Office-based businesses, including telework, but where telework remains strongly encouraged. Dining restaurants, other facility amenities like bars or gaming areas are not permitted. Those are part of later stages. Schools and childcare facilities, outdoor museums, and open gallery spaces. To be clear, these types of businesses and sectors that I just mentioned are not prohibited, are not allowed to open within tomorrow, beginning with the governor's modification of the statewide order. These businesses will be taken into consideration as Calaveras County readies ourselves under those readiness parameters produced by the state. And upon attestation and submittal to the state that we meet those readiness parameters, we will begin to move into these openings of these businesses under a modified manner. And then lastly, for clarification that we received from the state, businesses that will not be allowed to be reopened under the stage 2 include personal services such as nail salons, tattoo parlors, gyms, and fitness studios, hospitality services such as bars and lounges, entertainment venues such as movie theaters, gaming facilities, and pro sports, indoor museums, kid museums, and gallery spaces, zoos, and libraries, community centers including public pools, playgrounds, and picnic areas, religious services and cultural ceremonies, nightclubs, concert venues, festivals, theme parks, and hotels/lodging for leisure and tourism. These are part of stage 3 and will be addressed at a later date under state-specific guidance. So in addition, in terms of Calaveras Public Health readying for this, the team is very busily working on responding to those readiness parameters that were released earlier today so that we can provide that information to the state so that we do have the ability to progress through stage 2 of reopening. So before the close of business today, the local public will be able to find information about that first sector of businesses that I detailed earlier on our COVID-19 webpage. That information is already available on the California Department of Public Health COVID webpage. They loaded it today. So the public is welcome to gather that information there. Moving on to the next area that I wanted to address, during these regular updates to the board, I have and will continue to share the impacts of COVID-19 as it relates to Health and Human Services Agency programs and services. Over the past few months, while the COVID pandemic has been in occurrence, we've seen an increase in requests for CalFresh benefits as it pertains to comparing our data against 2019. In order to help our community, we have done increased outreach on how to access these benefit programs via telephone or online services. The Prevent Child Abuse Council recognized April as Child Abuse Prevention Month in our community via a proclamation that was accepted by the board late last month. Child abuse occurs when parents find themselves in stressful situations without community resources and without the knowledge and skills to effectively cope. During the COVID-19 pandemic, some families may be experiencing an increase in stressors due to workplace and school closures. Economic and housing instability coupled with isolation can create undue stress on families that may result in child abuse. When children isolated at home, away from mandated reporters and the community at large, incidents of child abuse may be going unreported. This theory is supported by the facts across the nation and in our state, as well as in Calaveras County, as reports for child abuse to local child protection services agencies have decreased significantly. During this stressful time, we must all take an active role in ensuring the safety and well-being of Calaveras County children. If you see something, say something. For parents in our community, if you're experiencing stress and you feel this is impacting your ability to care for your children, please reach out. You're not alone. There are professionals in our county that are willing and able to support you and your family during this time. If you have questions or are worried about the safety of Calaveras County children, please call our emergency hotline at 209-754-6677 or 1-844-690-5137, 24 hours a day, 7 days a week. There are additional resources on our website about how families can reduce their stressors. Those are available on the First 5 Calaveras website. In accordance with May being Mental Health Awareness Month, we want to remind our community members of the supports that exist in our community. We have 24 hours a day, 7 days a week response for crisis-related mental health needs for all community members, regardless of insurance. That number is 1-800-499-3030 or 209-754-3239. We have not seen significant increases in our request for behavioral health services at this time, but that doesn't mean the need is not there. We encourage our community members to visit our website for resources about how to cope with stress during COVID-19, find information about Peer Run, Warm Lines, and much more. Lastly, I wanted to provide an update on a program that the Board of Supervisors provided direction to staff in early April to proceed with. Calaveras County is now able to offer non-congregate shelter for residents needing quarantine capacity from populations that do not need hospitalization through a combination of various resources, including Project Room Key, which was provided updates throughout the past month or so. First responders who test positive or have been exposed, healthcare workers who test positive or have been exposed, non-homeless persons referred by the public health epidemiological team who test positive or have been exposed for those testing positive or have high health risk issues. And lastly, homeless individuals who test positive, have been exposed or have high risk health issues or need capacity to shelter in place. This project and the ability to meet all of the non-congregate shelter needs for many of our residents, as I've detailed above, was done so by the tremendous work of Calaveras County staff, as well as local community-based organizations done in partnership. They were able to bring together a number of funding resources and expertise to be able to do what we can to meet our non-congregate shelter needs for our community members. Those programs are being operated utilizing a number of wraparound services, including but not limited to 24/7 security, food delivery services, etc. And with that, I will conclude the overarching Health and Human Services Agency update, and Dr. Clado or myself can take questions.
Okay. Does the board or city council have any questions for Dr. Clado or Mrs. Stranger?
I do. It's Linda from City. Okay. I had a question. Shall I go ahead?
Yes, please.
Okay. With what regional variance, what would a regional variance look like? Right now it's curbside. But if we were to take and get permission to go beyond that, what would that look like?
Well, I can address that. So regional variance refers to the process that a county can go through to say that they meet the ability to safely expand into stage 2 more. So when it comes to regional variance, those are the things that I talked about, like having the epidemiology that favors it, the low enough caseload of COVID-19 infections, the hospital being able to take care of sick people, the ability to do contact tracing. Those different ingredients are the parameters that go into that local variance process. And once the county can demonstrate that they can do all that stuff, then they can attest to the state that they meet those criteria, and they can be granted the local variance to be able to move in front of the state and deeper into stage 2. So that's what that term refers to.
Well, what I was wondering, actually I have 2, maybe 3 questions, but what I was wondering is, okay, it's curbside. So if we had a regional variance where we've found all of those things that we're fulfilling those, would that mean possibly people who go into store with, the hand sanitizing and 10 people are keeping spaces? I mean, would that be how it would look?
Yeah. Kristen, why don't you explain it in a little bit more detail, what the difference would be between the things that we can allow for now and the things that will be allowed for once we can attest that we meet those variance criteria?
Sure. So the concept of regional variance is more related to the process that Dr. Clado just went over. In terms of your direct question about retail, in-person retail and not curbside delivery, that is something that could occur later in stage 2, after the readiness parameters have been attested to. Immediately starting Friday, before any of the readiness parameters have been addressed, businesses such as retail with those types of businesses that I described earlier are the ones that can operate in a curbside manner only. So we are not at the point today, this afternoon, or even tomorrow, where we will be seeing in-person shopping going on. For now, it must remain at curbside or delivery.
Yes, yeah, but we have to fulfill that, and then that could be maybe a jump ahead of Yeah, I mean, we would move more quickly, I guess you would say.
Yes, but that would come after the readiness parameters.
I have a couple other questions, but let other people ask what they, other members, and then I'll come back to it.
Okay, thank you. Mr. Stopper.
Thank you for bringing up the local variants. Quite a few things, not so much questions, a lot of statements, and some possible requests for direction. They made 33 modifications to the guidance today. I want to note that two things. In phase one, the governor did say today real estate was part of phase one, so those things should be on the list for opening up right now, as opposed to tomorrow or for curbside and everything else. So real estate's already on the list. He also did bring up the variants, and the restaurants in qualifying areas can open under the right controls as soon as Tuesday, as long as that variance process is moved forward. You did bring up the variants, and you did bring up the readiness for the variance qualifications and criteria, but the two steps to the local variance, the county has met certain criteria containing COVID-19 may consider increasing the pace at which they advance through stage 2, but not into stage 3. It reads on, but first step is notifying the California Department of Public Health and engage in phone consultation regarding the county's intent seeking variance, which, is something that could be done potentially immediately, that we may be seeking variance, and then move on to the second piece of criteria. Certify through submission of a written attestation to CDPH that the county has met the readiness criteria outlined below, designed to mitigate the spread of COVID-19. And it goes on to the attestations of what we go through that submittal process. And it includes the county board of supervisors, the public health director, and the healthcare systems in the area in the writing in the new order right here. With that, I think, here, let me go to this, what I have here. The public health official's duty is to the health and safety of Calaveras residents. The resources under that authority should be dedicated as such. The acquisition of PPE, ventilators, testing facilities, and testing facilities and feet on the ground should continue to be the first and foremost priority of the health authority. Those are resources you have to, that's where you work towards. At the same time, the county's part of this through the new order, and we have the resources to work with you on what type of criteria we're working on with the businesses as we move forward with the variances. So I would make a suggestion to the board, if no one's against it, that we agendize an action item for next Tuesday. Something to the effect of one, progress through stage 2 expeditiously, because we are in good standing in my eyes. I do believe the public health director has done great work in moving forward in his preparedness. And 2, pursue a variance that between admin and public health, they assist businesses to meet the requirements of a variance. And that is, to that, I would like something agendized on next Tuesday's meeting for an action item for the county to move resources to help the public health authority through that part of the process, and support with a supporting letter from the board of supervisors, which is required underneath the variance. If no one's against that, I would look for some guidance towards getting that on next Tuesday's agenda, please.
Let's wait and see
Okay.
what the other questions are and response from staff. Mayor Joe?
Two things. Am I correct in understanding that the 6 items for readiness, we've pretty much checked all the boxes? Is that correct, Doctor?
Well, yeah, but it's not quite that simple as checking boxes. We've evaluated each one of those criteria, and I feel that we either meet or are at the cusp of meeting all of them. So I don't think, I feel like we're very well positioned to meet those criteria and to be able to move forward into stage 2 ahead of the state as a whole. But, you know, we have to look at the details and what the process is for being able to attest and being able to do that. So it's a process, but if we just look at the criteria, I do feel that we are in a position to meet all of those criteria at this point.
But I guess what I was getting at was that the process, it sounded to me like, includes a phone call, and then B, written attestation following that up.
Yeah.
And so to Ben's point about the timing of it, you know, what do we need to do as a board and a council to make sure that's teed up and ready to hit as soon as possible? And then I had another question about containment and the capacity. Are the tracers and the people involved in containment recruited and residing within the county, or are we part of a bigger pool that does, you know, that's carried out at someone else's direction?
It starts with the county. The public health department has staff that is dedicated to epidemiologic investigations and contact tracing. We need some support from outside of the county to be able to have enough people, boots on the ground, to be able to do that work. And so the state is helping support that parameter for increasing contact tracing by providing us some technical assistance and logistical support to be able to do that. So we're getting help to do that, to be able to meet that criteria at the degree that the state wants that to be met.
Okay.
This is Kristen. Oh, I could provide a little bit more.
Comment, and then I'll release. As we progress with the oral communications with the state and the written communications and all that, I just want to be clear that as a county, City of Angels is inclusive, so that there's no question that there doesn't need to be any separate communications. Whatever's agreed to, you know, we're part of that, and there's no distinction. So just want to be clear on that, and you know, hopefully that's the way it'll all be structured.
Thank you, Mayor. Supervisor Tuffanelli.
Thank you, Madam Chair. Kristen, you had additional information you wanted to speak of on the mayor's question?
Yes, thank you, Supervisor Tuffanelli.
Yeah, go ahead.
As it particularly pertains to the contact tracing, that is probably one of the elements where we're very well positioned on that. And we were able to do that by having very experienced seasoned staff as part of the epidemiological team, as Dr. Clada just detailed. We also were able to have other county staff go through that very first state training that was beginning today as part of the test county sites that the governor has been detailing about wanting to build up the larger workforce. So we have layers of being able to access contact tracing staff, and we're very pleased for that. And then if we have additional need beyond that, we can even tap into the state resources as well. But a lot of pre-planning was made, so we are pretty well positioned to be able to do increased contact tracing and investigation.
Thank you, Kristen. It's my understanding from what I gathered yesterday and what the governor said yesterday, as far as these tracers, that he's looking to train an additional 20,000 to help the state and help the counties out to get to this position, to get to phase 3. So I think he's helping out, committed to help out doing that. But I want to say this, Ben, thank you. A lot of what you said is what I was going to have to say. But I do want to point out that today's news conference by the governor, he brought in the state public health director who spoke on some of the parameters of moving forward of the variants and further into phase 2. And it was my understanding from what he said today that on Tuesday, he will come out with more information on what's needed to move through and phase 2 and get further into it. So I think there's some additional information other than what was said today and the parameters today that they talked about that's going to be brought out by them on Tuesday that we have to still meet. What those are, I don't know, but I do agree that we are pretty good shape. And from what I was checking boxes off, and I know it's not checking boxes, Doctor, but we are in a good position from what they initially have said you need to do to move further into phase 2. That being said, as we move further into phase 2, I know it's not going to be overnight. And again, I'm in favor of bringing something to the board as soon as possible on Tuesday with an agreement with Ben, so we can move through this quickly. It seems to me that if we don't do that, just from my understanding, we may lose some control of people just opening up and doing things. So we need to keep containment on it and move through quickly so we can get to that and be able to control everything that we need to control. So that's my statements.
Do any of the city council members have any questions or comments they'd like to make? Veronica, please.
Hi, Dr. Kaleda, you said that through the listing of the 6 items that we were on the cusp of some of them. Could you identify where we're just lacking? Because obviously everybody is very anxious to move forward as quickly as possible, show that we are in good faith and good standing. So if we're looking at these 6 and then the governor's coming out on Tuesday with more detail, again, like everybody, I think we just want to know real detail of where are we lacking and move as quickly as possible to meet that, whatever that criteria is.
Yes, some of the criteria are very straightforward, numerical markers that you need to make. Some are a little bit more, we have to figure out exactly what we're being asked to do. Like an example is the protection of stage 1 essential workers. So what we're being asked to do is to ensure that we have the ability to protect all of the essential workers in the workforce. Those are people, not only just healthcare workers like doctors, nurses, people who work in nursing homes, that kind of thing, but also people who work in grocery stores or PG&E, people that protect the electricity grid, those kind of things. So we're still seeking a little bit of clarification of what it means that we have to do to ensure the protection of those essential workers. So when I said that we either meet or we are on the cusp of meeting those different readiness parameters, the ones that I feel that we're on the cusp of, I'm saying that because we need to get a little bit of clarification of exactly what we need to be attesting that we have the ability to do. So I think it's just a matter of a little bit of clarification from the state of what they want us to be doing in those other areas.
So do you think that will come on Tuesday, that more clarification? It's and I'm sure you and everybody else on the panel here is, we get a list, we meet it, and then there's more clarification. So it's, 2 steps forward, 1 step back, and as we all know, all our constituents are chomping at the bit here.
Yes. At the end of the day today, there's a call again to clarify some of these issues with the state. So we should get that information that we need within a very short time frame.
Thank you.
Any other city, Ms. Herman, you had some additional questions?
Yes. From my understanding, when I was watching the governor and what he said, it does seem like it's now up to the county, just a kind of a statement. So just I think a reassurance for the public too, that we as a county are well in step with being able to probably move, into a little bit more of the stage 2. But one thing I thought might be helpful is that tomorrow is soon. And I think it was said where to find this information, but the governor was saying, try to have contactless payment procedures and sanitizers outside your door, protective gear, gloves and masks, and try to take it to people's trunk or not, so these were things for the curbside. And so it seems that those who are able to open, I was thinking things like gift shops and jewelry stores and things, I would think those would be included. That's kind of a question. So anyway, where could they find that information so those who want to open tomorrow will be ready?
This is Kristen. I can provide an initial response to that. So we are loading the information that was made available to us today onto our webpage for the COVID-19 webpage. In addition, the community could also visit the California Department of Public Health webpage. They created a lot of enhancements today right as the governor was providing his update. And it has those industry specific standards, and it has the clarification. I actually was reading earlier from the documentation that's on that webpage. So that is a good place to start. And we are also loading that information, as I had just said. I can, in terms of procedural, because this is a question I believe community members might ask as well. Calaveras Public Health is not going to be reviewing individual compliance plans this evening for a tomorrow morning start, right? That's just not a plausible thing. So we know that our community and our business owners are very responsible business owners, and with the guidance put out there tonight, so long as they have those items in place and they're able to operate safely under the guidance, they would be able to begin operating under that modified manner tomorrow.
Ms. Harmon, do you have anything
well,
else?
I just wondered one more thing possibly, and that's just the room key. I was kind of curious. Do we have many people using the room key situation?
So far, we have about 20 individuals with various conditions under various categories within there. We have had one individual who was COVID positive at one point and has since recovered. One of the 13 recovered. So that was a really great service to be able to meet that individual. Project Room Key does have very specific requirements associated with it, and community members must adhere to the rules associated with the program, and that's to preserve the program as a whole. And so far, we've had really, for the most part, very good response from individuals who are taking part in that support, in that service that we've made available.
Ms. Wallendorf?
Hi, I have a couple questions, somewhat follow up to the questions I'm about to ask. So in number 3 of the requirement, I think it was number 3 of the testing capacity, which you indicated 70 per day for this county. How do we encourage people to get tested to keep these numbers? Are there sideboards to these numbers to make sure we can continue to keep going on to open? And how do we not create a stigma around people getting tested?
The testing capacity at 1.5 per 10,000 population is kind of the metric that the state wants us to be able to have the capacity to do. And like I said earlier, that can be met with the ability that we have currently through Mark Twain Medical Center, Valley Springs Health and Wellness, the MACT Clinic, as well as the new test site that's supported by the state in Lodi. So the goal is to get patients access to testing much better and to get testing parameters spread out so that we can broaden the groups of people that we're currently testing. So this morning we sent new testing recommendations to all of the medical providers that it loosens up the criteria of who should be tested, because we want to try to spread the testing into a broader segment of the population to include even some groups of potentially asymptomatic people, like example, healthcare workers, people who are in nursing homes. If a hospital releases a person from the hospital to the nursing home, we want to test that person even though they're not having symptoms of COVID-19 infection. So we think that through the testing of the nursing home and through the increased access to testing, both in our community and our neighboring community in Lodi, we'll be able to meet that testing criteria and use that testing information and capacity to ensure the safety of the public, that we're not getting a resurgence in cases of COVID-19 infection.
Okay, thank you. And then the second part is with the new testing center in Lodi, if individuals are not able to get there, is there going to be support to help them get to the testing location?
That's possible. It's not particularly addressed in the plan for that testing site. I don't think that transportation is one of the functions or capabilities of that testing site. But we could look into other accommodations for getting patients tested within our community if they happen to be closer to one of the existing opportunities or venues to get tested in the community. Then we would make good faith efforts to get that person tested in another capacity that's closer to their home.
Okay, thank you.
I have a question on the testing. If someone kind of meets the criteria, but they don't have a recommendation from a physician, can they still go to the test site in Lodi?
Yes, the test site in Lodi, patients can, sign up for, get an appointment, and get tested without being referred by a doctor or a medical provider for that test.
Okay, thank you. I'm interested in Ben Stopper's comment about, well, if we do all this Tuesday, the restaurants can open. That kind of wasn't what I heard. Could you or Ms. Stranger please address what the conditions are? I mean, I don't want to I don't necessarily support bringing something to the board because I'm really not clear what would come to the board. I'm not sure where you, Dr. Kaleda, would be ready to submit our variance. I mean, I know you can make a phone call, but there's a lot of conditions that you have to attest to.
Yeah, once we meet those conditions, those readiness criteria, once we meet those conditions, once we can attest to the state that we're able to meet them and that we qualify for them, then we'll be able to allow for moving further into stage 2, which does have the potential for in-restaurant dining with very specific criteria involved in that. So exactly when that's going to be, if we could do that by Tuesday, we're going to be working on it. Believe me, we are working on this around the clock. So we will be working on this to try to get this done as quick as possible. That's why both Kristen and I have used that term, that we're doing this as expeditiously as possible. But, we don't want to do it precipitously. And so that's the balancing act between doing something expeditiously versus precipitously. So we are working on it. We will do it as quickly as we can. But my goal and my overarching need is to make sure that it's done safely, that we're doing it in terms of good science and good public health, and that the health of the community is continuously being protected all the while that we're moving through this process.
Got it. So normally we have on the agenda an update from you and Mrs. Stranger. So we could still have that on the agenda. But if you're not ready for us to do something, I don't see how.
You're taking what I said out of context.
Pardon?
You took what I said out of context, Rita.
Oh, fine. Could you please clarify?
Yes, I said an action item so the board may support with our resources and progress through stage 2 expeditiously. Pursue a variance that between admin and public health, they assist businesses to meet the requirements of a variance. That's what I was asking to be agendized. What the other thing I had brought up about those is the governor said today that if these were all met, restaurants could do that as soon as Tuesday potentially, but that's not what I was asking for on the agenda.
I didn't hear him say Tuesday, but because I just heard the guidelines were be coming out on Tuesday.
Understood.
Tuesday.
I mean,
Correct.
I think the board, to authorize the chair to write a letter of support when Dr. Kaleda and Mrs. Stranger are ready, we could do that on Tuesday.
Yes, I was sorry, just to jump in, I was going to recommend, since part of our ability to move more quickly through stage 2 does involve the Board of Supervisors needing to submit a letter of support in support of Dr. Kaleta's attestation, that it would make sense to agendize that so that the board can take action to do as you just said, Madam Chair, and go ahead and send that letter as soon as the attestation is prepared.
Okay. Supervisor Tuffanelli?
Yeah, I had a couple questions about testing that Dr. Kaleta was talking about. Doctor, the 70 is the benchmark. We can't force 70 people to go get tested every day. We may only have 6 one day. We only may have 20 one day or so forth, but we need to meet that ability to qualify. And so my question is, since we're going to San Joaquin County and to Lodi, and you could just go on their website or you could call and make an appointment there, is that information, if somebody from Calaveras goes there, is that information being tracked so we know the number of people that have gone to Lodi, either daily, weekly, or monthly, so we can have that information for us to deal with?
Yeah, there's a process to be able to get that information back. So when the person goes to the website or they call the 800 number, they have to say some basic information, demographic information, their address, their phone number, their contact information, the way that they're going to be able to get the result of the test back communicated to them. And so that information of the county of origin and residence of that person gets reported back to the local health department. So we'll have a running ability to track who's getting tested through the Lodi OptumServe site.
So we've tested currently, what you said earlier was 450, which is about 1% of our population so far.
Right.
And I don't know if the parameters are going to be different come Tuesday to go further in, because all of that information we haven't had from the State Department. So, but at least we've done 1% of our population.
Yeah, and if you, there are different ways to crunch those numbers. Another way to look at it is that in the last 8 weeks, that's how many people we've done since testing first started. So that's about 7.5 or 8 a day. So you can see how far off that is from 70 a day. That's historically where we've been right now. But that's not a real fair comparison, because at the very beginning of this crisis 8 weeks ago, testing was very scarce and difficult to come by. We had to send every test specimen all the way to the CDC lab in Atlanta, Georgia to get tested. So now testing is more readily available. We've expanded the criteria to the medical community about who gets tested, and the sites where people can get tested have very much broadened and expanded. Another way that we'll increase testing capacity locally is by doing more surveillance types of testing. Like, for example, I talked about testing all of the nursing home residents and staff. We might want to test other high-risk venues in the community. For example, assisted living facilities, Foothill Village and Angels Camp, for example. By pursuing those surveillance testing programs, we also have testing numbers that we can show that we're meeting that criteria as well.
Thank you.
Madam Chair, I'm not capable of raising my hand.
Oh, I'll go Mr. Mills and then Mr. Garamendi.
Thank you. It's interesting. I don't want to really get into
Why, did you break your hand cutting your hair?
Yeah, right. I don't want to really get into any kind of a substantive discussion, to yes or no to anything that's been discussed to this point. But I want to, our businesses are really chomping at the bit. They're going to do whatever we need to do to get going, because the state already has said they're in a $54 billion shortfall. That was released to the press today. I was on that call today, and I heard the words from the governor about flexibility is important. But I also know that Placer County leaders approved a resolution to create a plan. I have the Lassen County plan, which was submitted, I think, May 1st. It's 47 pages long on their roadmap. But I'm also hearing that the state wants to review these applications, even though the Dr. Gailey said that they would be self-certifying. So could you kind of explain to us just how quickly or whether or not our ability to get a plan together is going to create any kind of impediments or roadblocks to our businesses getting up and getting moving? That would be to the doctor.
Yeah, well, like we've previously said, we have to be able to review what these criteria are. We have to compare that to the situation that we have locally, and we have to be able to attest that we're meeting these different criteria. So I don't know if these other, communities or counties that you're citing, have some, access to information in some inside way that we don't have. But this information was just made public to us today, and there's more information that's coming on Tuesday that'll allow us to finalize this local variance process and get our businesses to be able to move further into stage 2. So I think that's the best answer that I can give you, is that we've just gotten this information, we're working on it around the clock, and we have some further information to both clarify and receive from the state to be able to continue to finalize and get those other businesses going like you're interested in doing.
This is Kristen. I could,
Go ahead.
Supervisor Mills, I think I could add a little bit of clarification as well. Many communities, including ours, are engaging in a community-based recovery process as part of economic recovery from this COVID crisis. And that is going on. But specific to what we are talking about today, and the variance process, it's steeped in public health data and public health responses on testing and those types of things. So it's almost as if it's two slightly different tracks that are going on. And what we're covering today, again, is very specific to public health specific data, of which we received the written clarification this afternoon.
Well, I noticed in looking at the last one, which I have up on another screen, about their surge statistics, their guiding principles. They have an entire risk assessment. It's all there. I don't know if we need to reinvent the wheel here or try to figure out what other plans have been submitted and what does the state need for us to, as far as the review process, how long is it going to take for this review process for them to approve it, if they're going to approve it, or what kind of modifications are we possibly going to be expecting next Tuesday to anything we do?
Well, Kristen, please add any clarification as well. But from what I understand is that the state doesn't have to specifically approve our attestation plan. We have to be able to show that we're meeting those criteria, and the state will adopt that. So I don't think there's going to be a long delay of waiting for the state to get around to reviewing our request for attestation in those areas.
That's correct. It's posted to the state's website, the plan from the county, but it does not require a state level review. Approval, sorry.
Thank you. One of the things that's rather painful from my perspective is that there is a lack of uniform coordinated approach by the various county health officers within our jurisdiction, our area, specifically talking about the lakes that border our two counties. I take New Melones, it's closed, yet Don Pedro, anyone that can get there can have fun. Anyone can use Lake Tulloch because they launch off the South Shore and on the Tuolumne side, but the Calaveras side is open only residents. Hogan's closed. Pardee, the situation there. In fact, I got a call from KCRA this afternoon about it. So I wish and I hope that we would be sure that we're all kind of on the same page between these counties as we move forward, because if you've been to Lowe's lately, there's a case study in community transmission all by itself. What are these counties going to do? They're going to say, well, because Calaveras won't let anybody but their own residents in their county, maybe we need to keep them out of Amador or keep them out of Tuolumne County. It can't work that way. So I hope that we're coordinating with the other health officers in the other counties, so we're all on the same page as to how we're approaching this, and we don't push people from one county to another to try to find a way around the rules that we may be creating here that are not being created in other counties.
Well, Supervisor Mills, I have been in communication with neighboring health officers directly myself, And Amador County just today has allowed for a lot of the outdoor activities that Calaveras has already allowed for. So they're just kind of getting on the same page that we're on as far as allowing people access to outdoor physical activities that we have already allowed for a week ago. As far as opening the lakes go, our county doesn't maintain ownership or have the ability to reopen those facilities. We can say that it's now allowed for locally, but the lakes have to, like the Bureau of Reclamation, the people that run Comanche, those facilities have to reopen, on their own terms, and we can't necessarily dictate that to them.
I just put a timestamp on your statement because I've been on BOR conference calls over the fact of how to get New Maloney's open because of our statement about local only and the glitch that it's created with the federal partnership here. They don't want to create a problem. So as of yesterday, New Maloney's was closed. It's very painful to see that lake closed when these people are overutilizing Lake Tulloch almost in a situation of being unsafe at times because they can't go to New Maloney's.
Well, as the local health officer, Supervisor Mills, what would you have me do to rectify that situation?
I need New Maloney's opened, and I need that marina operational because it does support the fire department with the boats, et cetera, that are needed and provides the logistical support for anybody that's working on that lake. So having New Maloney's open is a critical piece of our infrastructure that as long as these people are creating the social distancing requirements that you're requesting, I have no problem with that. But it needs to be functional, and it's really critical whether they're going to survive if we keep it closed for an extended period of time into the summer.
So do you feel then that the provision that we've put into place in Calaveras to only allow Calaveras residents access to our outdoor activities, that's the limiting factor for the Bureau of Land Reclamation opening Maloney's?
That has been their impediment at this point in multiple conversations and also conversations with the Congressman's office. Yes.
Well, we'll revisit that with them.
I would very much appreciate it. I'm wanting to be sure that as soon as we're capable of getting our county back to functional normal in terms of the businesses, just tell them what they need to have and how quickly we can do it, and let's get moving on it. Placer County has had one fatality, I believe, one death. El Dorado has none, Amador none, Weave none, Tuolumne none, and I appreciate the work that people are doing to be sure that it stays at zero here. But at the same time, it's at a tremendous economic cost, and I don't want to be the one to report to the rest of the state that the only thing that died in Calaveras County was our businesses and our economy.
Is that all, Mr. Mills?
That's all I have for now.
Mr. Garamendi.
Thank you very much, Madam Chair. I think it's important for all of us to manage the hyperbole in our statements and try not to rile people up. If Supervisor Mills has a letter from the federal government representing the Bureau of Reclamation, the Army Corps of Engineers, and a letter from East Bay Mud saying that they're just happy to open up their property, then I certainly think the board ought to take it up. But I have not heard anything to that extent. But that's not my question. My question is to the doctor. We, in the guidelines, and I know you guys have only had about 2 hours to look at this before we even started, so I do not expect you to have all the answers. But it does have a criteria in there that there's only a certain amount of 1 per 10,000. So in our case, 4 cases. We have to meet within that threshold. What happens if we move to section 2B, and suddenly we've got 4 or 5 people that get picked up with the COVID? Do we go back to 1? Do we go to 2A? What happens at that point? Because now we're going to have more testing. We're likely to have more results.
The metric of 1.5, the metric of 1 case per 10,000 is a 14-day running average. So if we were to get, let's say, 1, 2, 3 cases, we wouldn't have to automatically shut down everything again. So it's something that we're going to be tracking and seeing. I think it's safe to say that if we do see an increase in cases, a rate of increase of cases that's concerning, it may be necessary to back off on some of those relaxation of the social mitigation activities that we have allowed to go forward. So that's always, it's sort of like a dial. We want to dial things, we want to dial the restrictions back, allow for increased activities, allow for increased business opportunity, allow for those things to go forward. But we're going to need to be maintaining the safety of the community. And if we see increasing case counts, if we start to see the hospital capacity start to be impacted, if we start to see that through our contact investigations that we're seeing increasing rates of disease in the community, we may need to dial that back a little bit.
Oh, go ahead, Ms. Stranger.
Supervisor Garamendi, you're picking up on a nuance that staff have actually already identified that needs additional clarification. And so we actually have already written that question into the state, and we will continue to, we're going to come across additional areas like in this guidance. It's an overarching guidance, and there's going to be areas, as Dr. Kleda found one earlier, that are going to need additional specific clarification. And that's why we are on calls multiple times a day, is to try to obtain that type of clarification.
And I'd imagine that for the public and for us, it's going to be important for us to convey to our businesses as they reopen that they have an obligation not only for everybody to keep healthy, but if they go by the rules and we don't have an outbreak, we get to keep going down this path. If people start slacking or not paying attention to the rules and we blow it, we're going back a long ways in our progress. And so I think that I would hope my fellow supervisors and city council members will work with our local establishments to make sure they understand that we're moving forward, but we can also move back. So let's work together and obey the health rules and see if we can't muddle through this as best we can. Thank you, though.
Did I understand you to say that the hospitality sectors like hotel, motels, B&Bs, maybe the Airbnbs would be in stage 3, and wine tasting would be in stage 3?
So according to the California Department of Public Health website, hotels for lodging and leisure and tourism purposes do appear to be not in part of stage 2, they are part of stage 3. Wineries specifically are not detailed in this particular guidance that I have available to me.
Well, considering that is a big part of the industry in Calaveras, it is a concern that they have asked, and I think I sent an email asking for clarification between what the ABC says and what the state says. So I'll be looking for an answer to that one too. If there's no other questions or comments.
I wanted to make one more comment if I could. This is Linda.
Yes, please.
Okay, fine. Thank you, Marita. One thing I was thinking, what I see in the public is they want to know that we are in tune with their suffering, and that the emphasis is on us opening as soon as possible, but with mitigation, and that is really, very strict. But I think if they feel that we're not in tune with where they're at and wanting to move forward, we just have to convey to them that that's where we're at. And then I believe they will go along with us and do the mitigation. But I'm afraid that if we don't show that concern, they will not mitigate. You're going to have a breakout. You're already seeing it. I've gone shopping and so on. You see kind of people lightening up and I hear more anger. So I think it's just us showing their representatives showing that we're there with them. We're doing everything we can. That, boy, they're going to have to really mitigate and follow the rules, but we're together on this. Anyway, that's my thought, and I don't feel that happening with some, not all, but some of the people who I am in communication with.
Yes, Ms. Mitchell, please go ahead.
Okay. I'm wondering, because we have been extremely fortunate, none of our cases have been in county. Because we're obviously extremely tourist driven, we're going to have literally thousands of people visiting from much more urban areas. And as good as our citizens have been, and all the people who have businesses and will adhere to the guidelines, I can't see how we will not get a case or 2 or 3 or 5 or 10. Is that going to be taken into consideration? That's the reality of it, of being tourist driven, is that we're going to have thousands, not just a few, thousands of people from urban areas who are hit much harder. And as good as our shops are going to be, then suddenly our people are going to be disciplined and have, oh, well, I'm sorry, you have to close your store again. So who's in charge of relaying that information and that situation to our governor's office, and really strongly advocating that, if these are cases that are not, that are brought in, how do we deal with that?
So this is why we have Dr. Kaleda and Mrs. Stranger to help us through that process. Very good point. But Ms. Herman brought up a point which is a good segue into Ms. Glanville is going to share with us the public comments that we have received. Are you ready?
I'm ready. I can start. We have 18 in total.
Okay.
Okay. The first one comes from Maria Ramirez. She says, please submit a plan to our governor to open up Calaveras now, please and thank you. Public comment number 2 from John. I am writing to ask you commit to a resolution to open Calaveras County back up. My business has suffered tremendously. Enough of this nonsense. Open up now or watch people leave this county for good. Public comment number 3. En masse are tired of losing our way of life. We need to be able to live our lives as we see fit. There is no one that can protect us against every danger that presents itself. Let us be free as Americans to choose what's essential for ourselves, what risks we are willing to take. Please open up our county so we can function as humans again. The sooner the better. There are a lot of good people that are losing everything. It's heartbreaking. From Marlene Chappell. Public comment number 4, open up Calaveras, please, from Carrie Norris. Public comment number 5, thank you for taking time to read our letter. Attached a signature document with 234 names of industry workers, clients, and concerned citizens. This is from Sissy Hedrick, and I'll read the first portion of her letter up to 300 words. It says, Dear County Supervisors, Dr. Kaleda, Sheriff DiBasilio, and other county officials. We salon owners, stylists, barbers, nail techs, and estheticians are writing to you as fellow Californians, proud of our state and even more proud of our community. We live in a rural county of less than 46,000 people, spread over 1,000 miles of mountains and foothills. We have only a total of 13 cases of COVID-19 here, none of which were due to community transmission, and all of them are now inactive. We are not LA County, San Francisco, or even the same as the Valley. A one-size-fits-all approach does not work. Our county is run completely on small, independent businesses. Most do not have jobs that can be done remotely. Every one of us relies on these businesses not only surviving, but thriving. No one wants to see them fail, and yet, if we cannot work in the very near future, more than one of us will be forced to shut our doors for good, crippling our local economy. For all of us in this industry, closing our doors has created a huge impact on our lives. We fall through the cracks of the programs supposedly set in place to help us. A majority of us have not received stimulus checks, unemployment loans, grants, or rent forgiveness. We have not worked for over 6 weeks. While that happens, unfortunately, we still have to pay all of our expenses, business, rent, PG&E, water, phone, among others. That doesn't account for our home mortgages, utilities, car payments, and insurance. These are basic necessities. We are an industry that is proud of what we do, even more than the creative or technical side of things. We create a safe environment for our clients to come and relax. Public comment number 6 is from Robert Hughes. To whom it may concern, I have been an outspoken critic of this lockdown since its inception, and as it goes against our God-given civil liberties, I am responsible for my safety, not government. With that said, small business has been opened up. People will be more damaged by losing their homes and financial means than a virus with such a low death rate. I am lucky enough to work daily in the Bay Area. No homeless bodies, no piles of deaths and destruction, only thousands of people working, taking off our stupid mask every chance we get out of sight of our Nazi-like police. Sure, not all police will enforce such tyrannical orders, but we never know who we are dealing with. Open up the county or we will do it for you and we will vote you out as soon as possible if you don't. Public comment number 7 from Sandy. Please open our county. People have heard enough. People here have had a hard enough time making ends meet. This lockdown is only causing more problems and a higher crime rate. Isn't this America? Public comment number 8 from Dana Lund. To all supervisors of the county, in regards to the current shutdown of the business in our county, I have been a resident of this county for almost 23 years. In the last 16 months, I have found myself so disappointed in our county, from the school district, the court system, and now our health department. It is time to let our governor know that we as a community are losing so much by this shutdown. We are not big business in Calaveras County. These are people with businesses that are not getting rich every day, but making a living supporting their families. Reopen now. Public comment number 9 from Craig Baldy. I am a business owner in Copperopolis. I own Copper Valley Cafe. Please allow us to open for full service. We will adhere to guidelines. We are on the verge of financial ruin and closing our doors for good. Please help me save my business. Public comment number 10 from Alan Victor. Open calendar is counting. Public comment number 11 from Mark and Kathy Holtz. To whom it may concern, it is our understanding that this is the proper email to use for advising the county of our desire to see it open once again for all businesses, schools, churches, etc. It is our observation that Calaveras County has been impacted significantly less than most areas, and some of the reported cases actually took place outside the county, cruise ships, etc., to residents on travel. We have respected the notifications from the health department and sheriff and will continue to do so. However, we believe the time has come to relax these restrictions due to the low numbers and significant impact it is having on businesses and individuals especially. We are seeing large sections of the county reopen successfully and believe that can be done here. Large sections of the country reopen successfully, and we believe that can be done here as well. Please consider rescinding the restrictions at your upcoming meeting. We appreciate your attention to this matter. Public comment number 12. From Herc Jorick. Dear board members, the time has come to get our stores, churches, and government facilities opened up and online again. The county has not seen one death from the COVID-19 flu. This pandemic is looking more like a planned demic. Let's not let our economy suffer any longer. I urge you to come up with a plan to help every business get back online in the fastest possible manner. Small business is the heartbeat of any economy. Thank you for your time. Public comment number 13 from Vicki Mills. How can I, as a member of the public, comment on something that is not available as part of the board package? There is nothing in the board package that tells the public what is contained in a presentation. Therefore, any comment made would be a general comment and not addressing what is in the presentation. That equals no public comment on the presentation. That the Board of Supervisors would think this is the way to handle public business is very disappointing. Public comment 14 from Nancy Dare. Please open up county or you may not have a county to open. Think about it. Public comment 15. To whom it may concern, I live in Copper Valley. I think what the county is doing is ridiculous and lacks common sense. A new Stanford University report shows a totally different mortality rate, one that is much lower. In summary, our economy can't survive the shutdown. Businesses need to start up again. Consumers need to get out and about. Below are thoughts of contradictions to the current plan and what will happen with continued shutdown. Number one, everybody can go to the grocery stores where everybody is in most cases closer than 6 feet distancing. Number two, everybody can go to our local hardware store, Ace Hardware, where the aisles are very narrow. No way can you be 6 feet apart or more. Number three, golf course finally opens, yet driving range is not. Why? My understanding is the county doesn't want golfers to gather, nor do they want the golfers to touch the range balls. I've spoken to a lot of members, and we all believe this lacks any common sense and is ridiculous. I called Sac County golf courses, and they are all open, and ranges are open as well. Number four, to shut down boating, fishing on the river, etc., again, made no sense. What is the logic in that? Number five, if you can grocery shop, go to the hardware stores, etc., why shouldn't the hair salon be open? The board can set rules, but to mandate them to be closed doesn't make sense. Furthermore, closed for up to 3 months, gas stations are open and viruses can spread via the hand pump. They're not shutting down, and quite honestly, it's up to the people to decide if they want to handle the pump with or without gloves. In summary, the county and the state needs to let people make their own decisions. From Kirk Wisbaum. Public comment number 16. To whom it may concern, we urge the county to open small businesses ASAP. Small businesses can easily control how many people are in their store. Disinfect after every client. Keep our flow small. Being closed for 7 weeks so far, we need to open our doors again so our businesses will survive. Our tanning distributors quickly switched their manufacturing to get us hand sanitizer. We have been selling it to clients for weeks, filling a need within our community. Our tanning clients tan for a multitude of skin conditions. We will list those here. As a psoriasis patient, when the mess first began, my doctor took me off meds as it weakens my immune system. My only other way to manage my symptoms is topicals and your business. I have active systematic lupus with skin lesions. My doctor says UV rays help joint and inflamed nerves, and dermatologists insist on UV ray therapy. I need you. I have 2 rods and 12 screws in lower back L5S1 with the titanium rods. When the titanium rods are cold, my back aches with severe pain. The heat from the tanning beds helped tremendously. Here are just a small few. UV light kills viruses, plus tanning in our salon is great for boosting vitamin D for our clients who are deficient. From Melissa and Ryan Scheller. Public comment number 17. From Liza Horath. I own Brugger's in Valley Springs. We have abided with the shutdown now for over 7 weeks, now trying to make ends meet with just takeout, which has been difficult. We need you to allow us to reopen while still respecting social distancing now. The shutdown is just plain illogical. We have not been hard hit. We have to get our business opened now. This phase process isn't going to cut it. Other counties have opened up, including dine-in restaurants. You all have been voted in for a reason. Now it is your time to support your community and not sit back and watch it crumble. Thank you. Public comment number 18. To anyone who would like to see Calaveras County open back up, please write in your own words to bosclerk@co.calaveras.ca.us before 3 p.m. today. The county is required to enter these emails into the database. Thanks for your help. As a business owner that provides holistic services such as massage therapy in Copperopolis, California, I am eager as many fellow businesses to open up safely. We need guidance and timeliness and support to get back to work, providing for our communities and families. From Jacqueline Youngquist. And that was the last email we received.
Have we received anything else, Mrs. Glanville?
As of 4 p.m. yesterday, no.
We
do have callers, though.
Okay, please proceed.
Do we want to ask if the city ask Susan if they have any public comments that they received?
Oh, good idea. Mayor, has the city received any public comments they want to share?
I'm aware of one email that was forwarded, and I heard it read today. So we're covered there. Open it up to other council members if there was anything else they wanted to add in terms of public input.
Could you proceed with the phone calls, Mrs. Glanville?
Yes. Caller with the number ending in 415, you're on with the Board of Supervisors and you can begin your comment now. Caller with the number ending in 415. Are you there? Caller with the number ending in 415, if you can try back, if you'd like to make a comment, because we're unable to hear you. Okay. The next caller with the number ending in 491, you're live with the Board of Supervisors if you'd like to start your comment now.
Hello?
Hi, go ahead.
Okay, I never got a caller number. I just have the number for the password. My name is Al Segala. I'm president of the Calaveras County Taxpayers Association. I have 4 items, and the first one, besides that, I'd like to really compliment everybody working on this. It's an incredible amount of work, and I really appreciate that. Also, the comments by Supervisor Mills hit the nail on the head and really went to the basis of everything that we have in the way of problems. We are a community that depends on tourism, not just the lakes, but everything else. And it'd be awful hard to require local-only discrimination. And there's a question of that, whether that would be constitutional or not. If it was imposed by police power, if it's done by a recommendation, well, that's different. Now, one of the things that we should be doing is testing for immunity in high-risk populations. These are the older people like me. By testing for immunity, you would get a blood sample and see if the person is perhaps open to maybe vitamin deficiency or something else where they could be very susceptible to catching a disease. This can be done without government money, but it needs to have government support, and especially support of our medical people. The next item is allowing older people to receive immunity blood, which is sometimes called convalescent serum. This is when people have had the disease, they have they developed immunity, and that blood is very valuable, and it could allow other people to also become immune without actually catching the disease. This should be explored further, and then the susceptible populations should be able to get these transfusions as soon as possible. And here again, we don't need government money, but we do need government support. The next item is testing for antiviral masks. These are masks that have chemicals that actually kill the virus. They're available. I was able to find them online, and anybody can do that. And I've ordered some for myself. They cost less than $1 a mask. And this, using these masks, would allow to do away with the 6-foot separation, which is hardly workable anyway. And also the confining people at home would no longer be necessary if these masks were widely used. One of the things that is prominent right now is a number of states and even local law enforcement.
Pardon me, Mr. Fiala, the time has gone past 3 minutes.
Thank you very much.
Caller with the number ending in 013, phone number ending in 013. You're live with the Board of Supervisors if you'd like to make your comment now. Caller with the phone number ending in 013, are you still there? can't hear you. If you'd like to make a comment, hang up and give us a call back. We'll move on to the next caller, the phone number ending in 717. You're live with the Board of Supervisors.
Am I on?
Yes.
Hi, my name is Troy Davis. I'm the owner of Old Iron Fitness in the Middleton Shopping Center, Angels Camp. It's really hard to kind of listen to all this, understanding that I own a small pocket gym. My wife and I have our life savings invested in that. We're down 55% of our membership, which puts us back in the red. As a business that's only been alive for about a year and a half, this shutdown is killing us. You're going to put us out of business in the next 2 months. We have 0 fatalities in Tuolumne, Calaveras, and Amador counties. Something needs to change, and it needs to change now. We've got a very sanitary facility. We're willing to comply with social distancing and all the other rules. We're known for our cleanliness. We never have more than 5 or 6 people in the gym at a time. And we need to get something done before we lose everything we have, including our house. Okay? And then you'll have another business gone and more residents leaving the county. Thank you.
Caller with the phone number ending in 717. You're live with the Board of Supervisors. If you'd like to make your comment now.
Hi, my name is Tanya Peterson, and I'm with the Murphy's Business Association. I'm actually the president of the association, and we have been meeting regularly on Zoom calls, conversations outside our community with regular people and our community, our business leaders, and really commend and thank our Calaveras County Board of Supervisors and the Public Health Director and Kathy Galino at the Calaveras Economic Development and every leader in our community right now that is really trying to lead with integrity. Sorry. And we are a very family-friendly community. And we are all concerned about our businesses equally, about our incoming visitors in and out. Sorry, this is an issue that we all are very compassionate about and concerned about because we are the hot spot of our county. Murphy's does attract a lot of people to these outdoor activities, to being together on the streets. And there is a collective collaboration right now that is working side by side with the county and wanting to get open with responsible guidelines and in check, with leadership that is positive. And we are working towards this to put a safety net around our county, not just Murphy's, but every person that comes inside and outside, every business owner and every customer. And I have been a business owner very successfully in my life. And I was the county roaster. I know what it's like to be in the center of community. And I'm very passionate about the group of people that are coming together with a smile on their face and ready to hit the ground running with whatever needs to happen to protect our community and our constituents in our corridor, the Highway 4 corridor, and throughout the county to across to West Point in different regions, north and south. I was an OAS SAR person. I know what it's like to work in a chain of command. And it's very important that we are coherent and collective and collaborative in our momentum forward. And I truly thank each of one of you, because I would not want to be in your shoes right now. And all of this just kind of hit me on this call. So thank you for the time and your time.
Caller with your phone number ending in caller with your number ending in 602. You're live with the Board of Supervisors if you'd like to go ahead.
Hi there. My name is Noreen Coca, and I own a small business here in Calaveras County. And I wanted to say that we have, we're so concerned about all the small businesses here in Calaveras County. A lot of the people that are purchased from us or do business with us are going elsewhere on the internet or to some of the large stores that are open, like Costco or Target or Walmart, and we're struggling very bad. And if we don't get our stores open, we are not going to have business. And Calaveras County is going to be losing a lot of businesses. And so I hope that you'll, and I actually beg the Board of Supervisors to please consider whatever you can do to get these businesses open. We are real cautious with the social distancing. We understand that, and we are hoping that you will consider this. And thank you so much for your consideration.
It doesn't appear that we have any other callers waiting at this time, Madam Chair.
Okay, let's wait a short time and then we will proceed.
Okay.
Okay, I'd like to close public comment and bring it back to the board and city council. I do want to address a couple of the comments that were made. I think the message from pretty much all the phone calls and the emails that we received were fairly consistent. We would like our businesses open. The person that did make a comment about there was nothing in the board packet about the presentation, I need to address the fact that the staff or Dr. Kaleda and Mrs. Stranger didn't get any information until about 2 hours before our meeting. It all had to do with what happened today at the governor's briefing and information they received at 2:00 today from the California Department of Public Health. So it wasn't an intention to not include anything. There was nothing to include when we put the agenda out. I would like, Mr. Kay, if you could clarify what the board has the authority to do. I think a lot of people think the board has the authority to set the rules and open the business in relation to the public health officer, what that role or distinction is, if you could please address that.
Sure. Sure. I'll try to be brief. I think there's a couple. So for one thing, neither the local health officer nor the Board of Supervisors has the ability to legally contravene what the state has put into place, and that's true for both the board and the local health officer. As between the health officer and the Board of Supervisors, in a local health emergency, a local health officer is mandated in the state health and safety code to take all measures that he or she feel are necessary to prevent the spread or further spread of a communicable disease. And a county Board of Supervisors is not given the statutory authority to override or alter what the health officer believes needs to be done to take care of that communicable disease. Specifically, and then I don't know if this was part of your question, specifically to what we're doing right now with what the state pushed out this afternoon. As mentioned previously, it's the health officer's duty to the extent we want to move more quickly through stage 2, the health officer is the one who prepares and signs the attestations that will go to the state, and then the board's role is to provide a letter of support.
Okay, thank you. Does anyone need any clarification on what our role is? Mr. Stopper?
That's part of it, but let's just be straightforward. The public health officer deals with health, and when it comes to talking to the businesses, he doesn't have the resources to do it. We can help facilitate him doing that, and that's part of our duties to help facilitate that, so then he can come to a clear judgment. So that's why I'm asking for it to be agendized the way I asked it for, is for that very reason. And not to circumvent the public health director as much as provide the resources needed to support him moving in that direction.
Okay. There were some questions that I thought were very cogent in terms of people can, and the gate swings both ways. We all know Calaveras residents who go to Target or Walmart or Costco, what have you, and we have local businesses that might provide those same services, but they're going out of county, and it doesn't seem to make sense. And I think that's a hard question for us to answer to our local community. But were there any comments or questions, Dr. Kaleda or Mrs. Stranger, that you wanted to address that you heard on phone calls or emails?
None from me.
None. Dr. Kaleda?
No, in fact, at 5, I think we might be able to get a little bit more information to answer some of the gaps in what we know right now as well.
Okay, thank you. I'm assuming that will come out to the City Council, Board of Supervisors, or however it's possible, so we can continue to fill the information gap that we all are experiencing. Do any of the City Council members or Board of Supervisors have any questions or comments they want to make? Final closing comments on this item? Outside of Alvin's hand? Do you want to chit chat? Oh, got it. Okay,
I do.
Mr. Brolio.
So I have a question for Dr. Kaleda. I know that, and this is kind of a weird question, the fatality rate in Calaveras County is 0. What is the fatality rate in California for 20 to 40-year-olds, 40 to 60, and like 60 to 90-year-olds? And is that the same rate as it is nationwide?
Well, I don't have those numbers at my fingertips. It is the case that most patients with COVID-19 infection will not develop serious disease. About 15% of those who get infection are at risk for developing those more serious complications that result in hospitalization and death. And if you look at the age breakdown, the demographics of the people who die, almost all of those deaths are in patients over the age of 65. And it ratchets up as you go 65 to 75, 75 to 85, those over 85, right? So yeah, those numbers are available, but that's just kind of the general pattern that you'll see.
There's just so much information out there now. I never know what is true. When I had you online, I was just wondering, and I thank you very much for that. And
Ms.
then,
Sermon, I'm sorry.
Go
Is
ahead.
that all, Mr. Brolio?
And no, just the last thing is that all the public comment overwhelmingly was to try and get our business doors open and operational again. And I think that is just a major key thing that is going through my city and through the county right now. And those are the closing comments I have. Thank you very much.
Thank you, Mr. Brolio. Ms. Herman, do you have something?
Well, I was just thinking one of the things that I think needs to be emphasized, if we can do it locally, is that those over 65 would be lag behind the rest of the public as shops are open. I figure, I'm almost 80, so therefore I'm going to hold back. When others start going down to shops and so on, I'm going to wear a mask longer. I'm going to kind of keep the isolation that I'm in and take my time so that I won't be one of those that now gets it, and then that makes the whole county, right, go back to a problem. So I think that should be brought out, and I think it should have in the nationally and in the state a long time, is we should emphasize that we are to sacrifice those of us who are older for the good of all the younger.
Thank you.
Mm-hmm.
If there's no further comment, Mr. Stopper had asked to have Ms. Follendorf.
Thank you. I have a question for everyone. So how do we keep this momentum going? And can we start the next steps of staff reports? I know you guys are working very hard, and it's not to add more pressure than you already have, but to keep us all working together and keeping this collaboration working to keep this momentum going. Because I feel like we really are working good together. Staff is getting things done, and I want to keep that support. And what are the next steps? What are we looking to do after, today at 5, I know he's about to say more, and then tomorrow and Monday or Tuesday, where are we going to go?
Okay. From what I'm understanding, I think it's going to be up to Dr. Kaleda and Mrs. Stranger to put the roadmap together, and with the help of, there's the health component and the economic component, the getting our businesses back together. And I believe that Dr. Kaleda and Mrs. Stranger have got the health component down. It's just that they need to, of course, keep us informed through the city manager and the CAO. And then there's the economic component, which I think Kathy has been working closely with many different segments of the community. And I mean, golf was sort of the kickoff one with all of its divots. And so we're working with the salons. The wine industry's already sent a list of guidelines that they would follow. So I think it's in the process of happening. I think your question is how do we keep the word out to the community? How do we keep the word out to the city council, to the supervisors? Because we're the ones getting the phone calls. We're the ones that are talking to the people on the street. And hopefully through your staff and county staff, we'll have a plan and we have plans to move forward. And what we're all saying to public health is the sooner we can do it with the help of the board and the city council, the happier all of us will be. I think that's what I heard Mr. Stopper say. Do I have that correct, Mr. Stopper? And I got to make sure I don't misinterpret what he says. So I'm assuming Mr. Alt on the agenda for Tuesday, or Ms. Clanville, that an update from public health is on the agenda. It usually is. And if that's the case, part of that would be possibly an action item, maybe not done Tuesday, but giving authorization for the board to write a letter when, Dr. Kaleda is ready for us to do that. Yes?
The standing item has just been a report, but we can update it for publishing tomorrow with an action, as has been requested by Supervisor Stopper.
Okay, I'm assuming I've heard Supervisor Tuffanelli was in agreement. Mr. Mills, are you in agreement? Nod your head. Mr. Mills, yes?
Yeah, I refer to my email to you on Monday of this week asking for this, so thank you.
Got it. Okay. Mr. Garamendi? Okay. You have 5-0 to turn it somehow into an action item. We don't know. Is that all right, Ms. Decay? I mean, she's looking at me. I'm thinking, okay, what did I do off guard
I'm not looking
today?
at you. I'm looking into the camera. Yes, we can certainly put an action item on the agenda for Tuesday. We've not yet published
So
it.
we might or might not need it, but I think if we have it, it's there for us to use. Okay. Ms. Vollendorf, I don't know if we answered or if I answered your concerns. Thank you. Mr. Mills?
Yes, Madam Chair. Mr. Kay, you might want to get some cards to hold up so that when we're off in a territory you don't want us to be in, you can kind of like have a flash card in the air.
Nah.
I'll get a squirt gun when we're all back on the dais.
Oh, no.
Okay. Mr. Tuffanelli, you had a comment?
Yes, I do. In answer to Amanda's question that she was asking, what can we do? Tuesday, we had an informational meeting, joint meeting between the city and the county. And I think if we could look forward to maybe doing those every Thursday, if we have information we need to have shared or updated, and that way we're all still involved in it and we're all still updated in going forward and keeping the ball rolling. I think that's what she was asking going forward, if we could continue that type of thing.
I don't know if she was.
Amanda, is that somewhat?
It's a good idea. Mr. Alt,
That's
Ms.
an
Eads.
option.
Pardon?
If that's an option, I will concur with Gay.
Okay, thank you. Mr. Alt, maybe you and Ms. Eads can work with public health. I mean, I don't think we want to take up staff time when everybody's sort of under the gun in terms of staff, but I think, Gary has a good idea. If you all can work it out and if it's appropriate, if we could do it, that would work. And
so we may consider just doing the joint meeting at the same time that we did it on Tuesday,
okay.
As we typically had, unless there's need to have 2 a week, as we did this week. But we already have the template in place to be able to do the joint meetings. I don't know how it fits for the city council, but I know that the first joint meeting we had was on our standing supervisor meeting day.
Okay. Well, we don't want to take up Dr. Kaleda's time and Mrs. Stranger's time.
So I don't want to be disrespectful to Supervisor Toffanelli's request. I was just suggesting that if we wanted to have the joint meeting, that it may be easier to fit it in the regular rhythm of the supervisors' meetings, or is it a suggestion that we have an additional on Thursday as well?
No, I think if we do it, the goal is to keep the city and county in sync on what's happening. That's fine.
And I think that's the point. It doesn't have to be every Thursday, but if we have information that we need to share between us all, then we could set something up. It doesn't have to be on a Thursday or whatever. I was just saying that if we could have these joint meetings, when the information is there that we need to know, it would keep us all on the.
Good idea. Okay. If there's nothing else for good of the order on that, I'm going to close that portion of the meeting. And there is the last item is any supervisor comments. That's the governor. He just wants to talk to me. I'm trying to tell him I need a haircut, but thought I'd write his wife. Do supervisors have anything they would like to share? Oh my gosh, the park. Excuse me just a second.
I got this.
Okay, close it up then.
Vice Chair, take
Ben, your
over.
vice.
She's back. Quiet.
Okay, in the spirit of cooperation, this is the time that the board brings up any meeting or anything they'd like to discuss, not on the agenda. Did the city council have anything they'd like to talk about? I mean, Mr. Brolo, are you going to tell us where you're going fishing this weekend or no? Okay, nothing? All right, this meeting is adjourned. Thank you. And thank you to tech services and county and city staff. We appreciate it.